So, welcome everyone to today's New England PTTC webinar, Incubating Successful Initiatives. Very excited to have Chelsey Patriss here from the Health Equity Partnership of North Central Mass. Today's event is supported by the New England Prevention Technology Transfer Center, which is funded through a cooperative agreement from SAMHSA in the Department of Health and Human Services. The opinions expressed in today's webinar are those of the presenters, not necessarily the official position of SAMHSA or DHHS. The New England Prevention Technology Transfer Center is part of the National PTTC Network, one of 10 regional centers and our National Coordinating Center, providing training and technical assistance to support the prevention community in adopting and implementing prevention science. We have a wide range of different types of programs available, including webinars like this one, a whole bunch of other types of online trainings and in-person events, as well as resources. So if you haven't been to our website yet, I would encourage you to do that and see what else is there that might be useful to you. As I just mentioned, we're one of 10 regional centers. If you are joining us today from outside New England, welcome. And I'd also encourage you to connect with your regional center if you haven't already. Sometimes there are region-specific resources that might also be available. Lastly, just a note from our PTTC network, we use affirming language to promote the application of evidence-based and culturally informed practices. We know that language matters and the words we use have power, and we invite you to incorporate this into your own work as well. And with that, I will hand it over to today's presenter to walk us through this topic and some of her work. I'm really excited to share this. I think it's really timely that we think about how we can leverage resources and work on building sustainability and successful partnerships in our community. That's what our prevention work is all about. So, Chelsey, I will hand it off to you, and you can take it from here.
Thank you so much, Kristen. Thank you for inviting me today. So this is a presentation that I originally did at the New England Rural Health Conference. And so just a little bit of background on my organization and who we are. The Health Equity Partnership for North Central Mass started out as a community health network area, or CHNA. And so if you're familiar with those in Massachusetts, they were created by the Department of Public Health around hospital catchment areas back in the early 1990s. They are meant to be public health coalitions that serve those hospital catchment areas and encompass a broad scope of social determinants of health. So we serve the 27 municipalities of North Central Massachusetts, which is mostly northern Worcester County. We are currently 1 full-time staff, that's me, and 4 part-time staff. We have over 240 organizational and municipal partners. That is because coalition is our bread and butter. That's exactly what we are and what we do. And so we have cultivated those relationships with organizations, municipalities, and state organizations as well. We participate in more than 40 advocacy, policy, and advisory groups. That's not a typo. That's literally what we do most of the time, is either run those advocacy, policy, and advisory groups, or they are working groups, advocacy groups that we are part of, because that gives us the opportunity to learn what's going on the ground with organizations that are really deep in the work, and also to take that back to other cross-sectional partners so that they understand what each other is doing, and then to elevate those to the state level so that there's more understanding of what's going on at the local level. We do the reverse of that as well. We sit at the state level, bring that information back to our local partners. So we really serve as this important connector and conduit between organizations that are doing the direct service and don't have time to do this work themselves. We focus on community and stakeholder engagement, community health assessment and planning, and building capacity across the region through building these collaborations. If anybody has tried to start a collaborative effort or a coalition from scratch, maybe you got a grant and they said, you need to do this in collaboration. It's a lot of work, right? Like to find the right partners, to figure out who's going to do what. Somebody has to run all of those meetings. So anytime we can get, you can plug into a coalition that is doing that work, it's much easier than trying to start that kind of work from scratch. So because we don't do direct service, this is all we do is this coalition building. I want to just give you a little overview of like how we use our funds. So a good percentage of it is our own staff, right? Are just the work that we are doing. The second biggest portion of that goes out to our partners in the form of awards, grants, and scholarships, sponsorships, so that they can do the work that we have identified. So it's really important to have that, yes, there's a coalition and we're all thought partners on how to do this work. It's also important that somebody's doing the implementation. So we're partnering with local organizations to build their capacity to actually do the work. Then there's always this section over here, which is grants and professional fees for when we realize that there is a gap, right? There is a need. Nobody in the area really has the capacity to do the work. And so we need to bring someone in who's a contractor, a consultant, to help us get to that next level. And of course, the goal with that is never to stay in that cycle of we always need somebody from the outside to do this, but that they are kind of moving us in a direction where they're building the capacity and we can start doing that work locally. Okay, so we hold what's called the Community Health Improvement Plan for our region, and that is based on community health assessment work. Within that Community Health Improvement Plan, we have 6 domain areas, and you'll see, so these are all really broad areas. They involve really deep work. Mental and behavioral health by itself is a huge area, right? There's organizations that do just a tiny slice of what's involved, even in mental and behavioral health. This is why we don't do direct service, right? We cannot do direct service work in all of these areas. So we kind of know who we are, which is we are that like blanket in the area that goes like 1 inch deep and a mile wide, so that we can bring everything together under that umbrella, recognize where there's cross-sectionality, and where we can build the capacity of the organizations that go deeper into each one of these domains. Now, when we did the Community Health Improvement Plan, any plan that's a strategic plan like this involves goals and objectives and strategies. So with 6 domain areas, we ended up with 13 goals, which for a staff of 1 and 4 part-timers is a lot. And a big region to do it in. So one of the exercises that we did with our community was we went out and said, okay, first of all, we needed to consolidate a little bit. So we went from 13 goals to 9 goal statements. These are not the full goal statements here, but you can see, what you'll see here is we went through an exercise that we called a key domino analysis. And rather than saying this is a prioritization exercise, which one of these things is the most important to address, what we said was which of these things move other things, which have this upstream effect on these other areas, and where do we as an organization belong? So because we're not a direct service organization, these three top tiers, mental behavioral health supports, safe and affordable housing and shelter, and affordable and culturally appropriate healthy food, these are what we call like the conditions for well-being and health. And those are what our direct service partners are down on the ground doing every single day. And we want to support our direct service partners in doing this. That's not our area. So this next level down, the orange tier, stratified out through this process that we went through as what we call like our living environments. So where do we spend the most of our time? We spend most of our time in the work environment or in a learning environment. And so within those structures, and in order to have those supports, this bottom tier is where we ended up focusing most of our resources and our time. And that is building anti-racist systems, having strong connections and collaboration across our region and our organizational partners, policies and funding that support public health and social services. Those three, when those stratified out that way, we were like, this is great. This is exactly what we do. This is what we spend all of our time doing. We are on the mark. And the other thing that popped up was affordable, reliable, and convenient transportation. And we kind of sat back and went, we know that that's foundational to all of these other things, to having access to education and jobs and having access to all of the social services. We also kind of thought of it as a direct service kind of thing. If you're not a transportation service provider, how are you improving transportation systems? And so we had to do a lot of thinking about like what our role in that particular area was. And we did what we do. We built a coalition around it and started stratifying out new organizations that did not exist before. So we now have a Transportation Management Association, a Regional Coordinating Council, and are building out a regional mobility master plan, which had not previously existed. All of our transportation planning was pretty much done at the municipal level. And when you have a lot of very small towns, that's really difficult to sustain and to connect. So I will get a little bit more into how that happened as we talk about like coalition building and why you would or wouldn't do it. But I just wanted to share that. Okay, so this kind of brings us to the idea of coalition building and the where's my lane. Like this was our, what are we doing here? Because we really want to make sure that we are not stepping on any of our partners' toes. We want our partners to feel like we are valuable to them and that we are valuing their expertise and what they bring to the table. And the last thing you want to do is create this like competitive atmosphere with your partners where they feel like they're the experts and you're usurping their mission. And so, you know, we don't have a region that is really large in terms of population. North Central Mass has a total population of about 250,000 across our 27 communities. So that's like pretty dispersed. Our largest city is under 20,000, is about 20,000. So really we're, you know, a pretty small spread out rural region. We do not have the resources or the population to support multiple organizations overlapping doing the same thing. We really need to be very strategic about who does what. So we have to ask ourselves all the time when we come across a grant opportunity or when there's a need that presents itself, who does this in our region? Can we support them to do it better? Can we help build their capacity? can we partner with them so that, or can we bring in partners to help them do it better? Rather than just saying, well, there's a need, so we're going to do something about it. And then once we've really done that analysis and talked to those partners and said, we really think that you would be good for this, how can we support you? Then if there's really no match, then we can say, are we the right organization to do this? Does it fit with our core mission? What is our role? If it is part of our core mission, what piece of it should we own? What capacity do we need to build or partner on in the region? And what partners do we need to pull in to do that work? How do we support them to do that? How do we share that grant funding or staff, if the case may be? Can we sustain this long term? So does this project live with us permanently if this is something we're going to start? Or is the goal to find a permanent home for this project and let it fly on its own, whether that's it becomes its own organization, or we build the capacity of a partner organization and we do kind of the launch phase and then it lives with that organization. So those are the kinds of things we really want to assess, because what you don't want is to get yourself into a position where you've owned something for 3 years or 5 years through a grant, and the grant is coming to an end, which means the project is coming to an end because you as an organization don't have the long-term funding or even the long-term mission to sustain that program. So we want to be really mindful of how and where we're building something and what we want its long-term life to be. Is it a project that only needs to exist for a set period of time, or is it something that we want to build and thrive over the long term? Okay, this is a very, very busy model, and I'm going to try and stay within an example without going too far into the weeds, but just to kind of show how this sort of thing works. So we have we did a bunch of research and assessment around food security in our region. We have a very food insecure region, and when we did all of that research, what we were really finding was that it wasn't just about our building up the direct service of feeding more people, of our food pantries and our direct service. We really realized that our whole food system was broken, and there was a lot of work to do. We assessed the farmers in our region. We found out that they weren't able to sell directly to consumers in our region. They were not thriving themselves. They were subsisting. Many generational farms were sunsetting. There was a lot going on in our food system that was not working, and just addressing the consumer end of food insecurity was not ever going to solve the problem. So we ended up working with an organization called Growing Places that moved into the space of the mid-tier. We did an assessment where we realized that what was missing in our particular region was aggregation and distribution. There was no place to process food for distribution. And when you're in New England, you have a short growing season. So you have a whole lot of produce that's happening in a very short period of time. It's going to go bad if you don't process it. Processing literally just means like chopping, freezing, the kinds of things that you can do to lightly preserve produce so that it can get back out into the community over periods of time. We also figured out that our institutions wanted to support local and were not able to do so because a large institution can't build a relationship with every individual farm and call them up on a weekly basis and say, do you have lettuce? We have, we need X number of pounds of squash, but we can't take whole squash. You need to cut it, peel it, cube it, because we don't have the capacity in our institution to process it. So there was this whole market that was not being tapped into. And so they were going, with the large producers or processors through Cisco and other large contracts. And so working with this particular organization who stepped up to be the backbone for this model. So I know enough about building coalitions. I don't know anything about processing food. I don't know anything about like the nuts and bolts of what. I'm not a nutritionist. I'm not a buyer. Like all of the ins and outs of that work needed to be done by the people who really know that work. And so through these partnerships, we were able to get schools that can now purchase directly from this hub. Our hospitals are able to purchase from this hub. Our farmers are making more money because they can sell their goods locally. We were able to get some grants to extend their growing season, get them hoop houses, get them all the proper certifications that they would need to be able to sell to a hub that sells to hospitals. There was a ton of work that went into it, and it would never have happened if one single organization had been attempting to make that work. One of the key reasons that this worked was that we had already started what we called the Anchor Collaborative, which was institutions in our region that are the largest employers in our region. Those are our colleges, our other schools, and our hospitals, primarily, a couple of other large organizations. But those organizations all committed to the local economy, whether that was supporting their own workforce through looking at advancement opportunities, training opportunities, childcare, transportation, other kinds of supports so that people can access the workforce, but also through what we called values-aligned purchasing. And so because we had socialized this idea of values-aligned purchasing and what this does for the local economy with our Anchor Collaborative, that's really where that mentality of we're going to make this food purchasing thing work, that's where that took root. Because it's not the easiest thing to do, right? The easiest thing for our institutions to do would have been to keep doing what they were doing. It wasn't even the cheapest thing for our institutions to do, but it was the thing that supports the local economy best. And so they had to kind of have that mission mindset to buy into this. There were a lot of things that we had to work through. Is this the right ordering cycle for you? Is this the right platform? How is the invoicing working? There were, all these bumps along the road where they had the opportunity to say, you know what, this is too much work, this isn't worth it. But they had to be bought into it and at that level to really make this work. So having that as a backdrop really helped this whole food processing center take root. So I'll go back to the transportation piece. Remember, I said we did this assessment. We said, okay, we need to get into transportation. What does that mean? So what we started started with was what we do. We just pulled all the partners together and had a very large meeting where we said, what do we actually want transportation to look like in this region? Never mind what we have the current capacity for, the funding for, what seems practical in your own organization or in your own municipality. Let's think big. Let's think regional. Let's think long term. In 10 years, what do you want this to look like? In 50 years, what do you want this to look like? Because it's not going to get there if we don't start somewhere. So we did this whole vision, values. All people who live in, work in, visit our region can easily and safely move to, from, and between the places they want to go. That is a very, very big long-term goal for a region where most communities don't even have buses. So the things that stratified out of that were workforce development. People can't access good jobs, or they have to choose who in their household goes to a job when they have little transportation in their household. So how can we access better workforce development? That became the Transportation Management Association. We leveraged a lot of those anchor collaborative partners because they were, again, bought into that idea of developing the local economy. It also made sense that we leveraged our Chamber of Commerce. Most of the partners that are the largest employers were already part of our Chamber of Commerce. And so what we did was brought in a consultant who knows transportation management associations, knows how these programs work, has launched them before. We did not have that capacity in our region at all. We did bring in our RTA and our existing public transit providers. This was not an adversarial thing at all. This was like, how can we build on what we already have? And so through a combination of these contractors and consultants, the existing partners, and our employers, that launched the Transportation Management Association. It lives with the Chamber of Commerce. I do not want to run a transportation service ever. I don't have the capacity. We don't have the capacity as an organization. The Chamber of Commerce was the right place for this to live, and part of our work was to find that right place. What we do own is the Regional Coordinating Council. That is essentially an advisory group and a learning collaborative of our social service partners. So the Regional Coordinating Council focuses on transportation that serves low-income populations, seniors, folks with disabilities, our veterans. And so having that service-oriented focus, we work with a lot of our councils on aging, our aging services and disability serving organizations, and our municipalities directly, along again with our transportation service provider, our regional transit authority, and learn about things like microtransit and volunteer driver programs and best practices, and then do a little bit of triage among the group when somebody has an issue that they're working with in their own community, so that other folks can say, oh, we can help with that. We can connect our service to that. Or here's what we did in that situation. So that these very small communities that often have like rotating staff, they're not able to keep a staff for very long, staff that may be brand new and don't necessarily, know everything there is to know about transportation. What we were finding was that there were a lot of programs that kind of started and stopped because we would get someone in a role who would be really into the idea of doing something. They would do it, they would get a grant for it, and after a year that grant would go away and there was just no way to sustain it. So part of the goal here is to build something that's more sustainable through those partnerships. And that fed into our regional mobility master plan so that we have all of these municipalities that are connecting with one another, talking to one another, trying to figure out how not to have duplicative or services that create gaps that don't connect with one another, so that we can get off kind of the hamster wheel of like starting a project and then stopping a project. Because the other thing that does is it diminishes community trust. And especially for a service like transportation, you need to build that over time. You can't have a transportation service that somebody relies on heavily that runs for 6 months and then stops. It's, detrimental to having future services. So that is our transportation work. And so co-response, this is more in line with, mental and behavioral health services, maybe something some of you are familiar with. We have one really good co-response hub in our region. And we really wanted to expand that into other areas of our community. So a co-response hub, just in case you're not familiar, is typically one police department that is the center of the hub, and other police departments that are connected to that hub. And they share a clinician, a mental health clinician, who goes on calls that have been identified as probably appropriate for a mental health call. They co-respond to that call with an officer, and they either take the lead, or they do a good amount of follow-up. It gets people out of the cycle of having those police interactions over and over, because they have a clinician who's responding appropriately and doing the follow-up and connecting them with other services. And it alleviates the need for police to be on calls that they get frustrated, right? Like they are unhappy when they know that they can't provide what this person needs, and they know that they're just going to get called again. And so like it helps to get people out of that cycle. So we knew that we had certain elements in place. We had a model that worked really well in one of our subregions. We had identified a funding source through the Department of Mental Health. And we definitely had a recognized need in our communities to expand this model. What we realized as we kind of tried to implement this was that we had certain elements that were missing. We did not have a lead organization, a police department in some of our other subregions that had the authority and the reach to bring the partners together. You have to have a police chief who's been there a while, but also who isn't on the verge of retirement. You have to have somebody who's committed to that model and is willing to do the work and is a good connector. And not everybody fits that bill. We also didn't have the data to access the funding. So part of what that program required was that police departments have a certain amount of data saying, these are the kinds of calls that were going on. And they had to have 2 years worth of calls that said how many of those calls would have been an appropriate co-response call. Because of the way individual police departments track data, they did not have that. What we essentially ended up doing was saying, okay, why don't we ask our police departments to start collecting the data in the way that they need to? Let's do that kind of training first. Maybe by the time we get there, we will have police departments that have a chief who's been there for enough time and is ready to be that hub. So I never really think of projects that aren't ready to get off the ground as, well, that was a waste of time. They're always like, oh, well, what can we do to build that for next time? Because there is going to be a next time. Like the need isn't going to go away, right? It's not magically going to solve itself. This is still the best option for solving this long-term need. How do we get there over time? So that is, and I'm looking at time because I want to make sure that we have a little bit of time for questions, but I think this is the last slide. So the elements of having strong collaborations is really that very clearly defined mission and values for that group. Everybody's busy. Nobody wants to meet just to meet. Nobody wants to attend a meeting if they don't know what their role is, what the ultimate goal of this thing is. If it just feels like we're just talking and venting, you really need to like have that mission and values to hold it together, or people go a few times and it kind of falls apart. You have to identify and build the capacity of that backbone organization that is either completely or mostly aligned with that core mission. Somebody has to own it. Somebody has to be the one who's sending out the meeting agenda, who's sending out the notes, who is saying, hey, here's a conference we should try and attend, bringing in the experts to do some sort of training. Kind of like if everybody owns it, nobody owns it. So you really do need like, who is the backbone of this? You need that shared ownership and commitment by the partners. So they do have to recognize, what is my role here? What am I getting out of this? And what am I contributing to this? And then a strong collaboration seeks funding for the planning and the capacity building, not just the service delivery that their own particular organization is going to do. So that is, yes, like, should you be seeking funding to maintain your organization? Absolutely. But when people within a coalition or a collaboration start competing for funding, it diminishes the whole thing. It makes everybody look like they're kind of fragmented and they're not on the same page. If that funder gets multiple applications from organizations that they know are supposed to be working together, it's not a good look. So we really do need to like make sure that we're talking to our partners and being super honest. Like, I need this position is going to go away if I don't have the funding for this position. Or, I don't feel like we do this. Like, this is something I could do, this piece of that. But you really need to like have those like trusting, honest conversations with each other. And then, so the programs and services that you implement have to have tangible benefits to all the partners. Again, if your partners aren't seeing the value or what this is doing for their organization or their mission, they're not going to hang around. And then engaging secondary partners along the way to do things like advocacy. Advocacy is a huge piece that, like, we have never written a bill. We don't have the capacity to build an advocacy coalition around one issue and really take that over the finish line. But we sign on to lots of things. We raise awareness with our legislators about lots of things. So, engaging those secondary partners who do that work on a regular basis, and sharing the load. When all of those are in place and your organizations trust each other, you can survive changes in personnel so that there isn't just one person at that organization who was your partner. It's built into the values of that organization, that they value a partnership with your organization. And so if one person changes over, you still have that relationship with the organization. That's a huge one. You can survive fluctuating or rotating funding. We are all in that mode right now, right? Everybody is looking at what pieces of funding are going away, what we thought was going to be sustainable and isn't. You can sustain the loss of one of your partners. They just don't have the capacity. Something changed. They're going away. They're shrinking their territory. And you can survive changes to the scope of your project. All of those things are sustainable if you have built a good, strong collaboration, and everybody's really subscribed to that mission. All right, look at that. Plenty of time for questions.
Perfect. Thank you so much. If folks have questions, please feel free to put those in the chat or the raise hand button. I hope that folks can see the connections here between, if you're in either a more substance use focused coalition, or I know many of us work in coalitions or are part of coalitions, and there are so many things, especially when we're working at addressing those root causes of substance use that, and these community needs, like Chelsey pointed out, transportation and housing, and those are outside the scope often of the substance use funding that we have. But I just thought this was a great, model to think about how can we use our coalitions to find the right partners, to launch some projects that maybe aren't the best fit for us to be doing that work directly, but we are the best fit for bringing people together, and that's what we're doing. So I think this is very exciting, as you can tell, and I hope it was helpful for folks too. And I do see a question from Will in the chat.
Yeah, for those who aren't able to see the chat, I'll read out the question. Can you elaborate on how your coalition is housed? Are you part of a hospital system? And so how is our work funded? The shortest answer is we are a standalone organization. So we became a 501c3. We were in a fiscal agency relationship up until 5 years ago, when we became our own nonprofit. We are funded. So Massachusetts has traditionally funded community health network areas through what's called a determination of need process, which is when hospitals do significant capital projects, there's a percentage of that that is supposed to get peeled off and put into community benefits. And so community health network areas were where those funds have traditionally passed through. Depending on how your hospital system has worked over time, some of those became very, very sustainable and very robust. Some of those organizations dissipated and went away completely because their hospital system did not have a significant capital project for enough time that there just wasn't any funding. Several of them did get absorbed into hospital systems as kind of part of the community benefits piece of things. Some of them became different coalitions depending on what kind of funding they ended up with and going after. So some of them took on funding that really kind of led them into a very niche role. So they became, substance use and mental health specific, or they became a coalition that was addressing like digital equity and dental health, depending on what their funding sources were. We were lucky enough to kind of decide intentionally that we wanted to stay at that very broad level so that we could address all of what was happening in the region. And it is always interesting trying to explain in like a grant application that this is the role, right? That we are the connector and convener, and that we're not going to give you a project with like specific direct service outcomes. So we tend to not even apply for most of that kind of funding. It is super challenging to find funding that is for coalitions and coalition building. I will name that right there. It is much easier to find funding that is for projects. And we happily pass that on to our partners, but we do not go after that kind of funding.
Yeah, I know there's so many different mechanisms for um yeah, funding this type of work, and requires thought about what your goals are as an organization, and how you hope to move forward. And
Yeah.
uh,
I,
yeah,
I will
I
say
think
too
you're
that
right. We do have kind of a similar mixed mixed system in Maine here as well.
I will say too that that is a reason why we have intentionally kept our staff very small. So we focus on partnerships with other organizations because we know that we probably will never have the kind of funding that would be needed to sustain our own organization as like a large staff. We're looking at models right now where we can share funding with some sub-regional stakeholder backbone partners, and do deeper coalition work at the micro level. But I don't want to build out a big staff because that's a lot of responsibility with no guarantee of how the heck I would fund that.
Absolutely.
And do we ever work with DFC coalitions?
It would be drug-free community
Yes.
coalitions.
Yes. So one of our partners in our region is kind of that backbone, for that backbone service organization, that holds that. And so they and we kind of co-lead the working groups around those grants.
Yeah, and I think that can be a nice role, if for folks who are in, if you have DFC funding, you'll have specific goals related to that, but building out, a partnership you know, with other coalitions that are aligned, and kind of um, using those levers once you've got a group of engaged partners, looking for shared areas of overlap, and ways you can connect those. It's, once you've got the wheels greased a little bit, and you can get some momentum, then keeping that going is such an important part. I will also put in a little plug, as folks are thinking. We're sort of um, thinking about sustainability, and I don't have registration open yet, but we will be doing a sustainability webinar, and then interactive learning lab kind of workshop series on Wednesdays in September. The webinar will be September 3rd, 1 to 2:30 at Eastern time, and then 1 hour learning labs on the 10th, 17th, and 24th. So if you're interested in diving in a little bit more in terms of kind of sustainability planning and what that looks like for your projects and organizations, save the date, and you'll see that coming out through our email list soon. Thank you so much, Chelsey. I lots to think about. I think what you're doing is exciting, and really needed. And I hope that others can, yeah, think about incorporating some of these lessons that you shared with us today. And if folks do have other questions, kind of either for Chelsey, or just about thinking about this type of topic, you can always reach out to us through the New England PTTC. I'm happy to connect you to Chelsey, and we also provide technical assistance. So we can, if you have a more specific needs in your community that you want some help thinking through, we're happy to help you do that. Thanks everyone for joining us, and we will hopefully see you all soon.